Hello everyone. Today I'm going to give a short introduction about the health QR code. What is the health QR code and why is it so special when applied in China during the coronavirus period? These are the two main questions I'm trying to answer in my presentation. So start from 2019, the coronavirus turned into a pandemic situation. And before we finally developed the effective vaccine to kill the virus, quarantine became the most effective way to control the infectious rate. However, it cannot lock down a whole country or stop people's life for a long time, especially for a big country like China, which has a population of 1.4 billion. As a result, Chinese government tried to bring people back to their normal life. However, with a working population of 1 billion, it can be very risky for Chinese government to announce a nationwide work resumption. It is under these circumstances the health QR code is developed. Basically, the code tried to answer the question, how are you within three colors, green, yellow, and red. So the health QR code will track your movement by tracking your phones, and it will also try to analyze your health situation by extracting data from different databases, such as your social media or your record of visiting hospital. As we can see from these two photos, there are actually different kinds of visualization of health QR code. However, the main character is always the color. During the work resumption period in China, you have to have a green code in order to enter the public spaces or use the public facilities. So if you have a green code, it means that you're good. There is a low possibility that you carry the virus. However, if you get a yellow code, you may not enter the public spaces and you will be suggested to conduct a 14-day self-quarantine, no matter in your house, at the hotel, or in the hospital. And if you get a red code, it means that there is a high possibility that you have already been affected by the virus, or you may closely contacted with people who carry the virus. And as a result, you need to go to the hospital immediately. By applying these health QR codes, start from February 2020, step by step, China began a nationwide work resumption. It is amazing to see that within 1 month, the nationwide daily coronavirus cases was kept under 50. So how and why can a health QR code be applied so efficiently in China? And before we answer this question, let's first talk about why the health QR code is very special. And I consider it is very special because it is a very democratic algorithm. So firstly, no one is asked you to use the health QR code. In other words, there is no official law to ask you to use or apply the health QR code or register for the health QR code. And secondly, the information you provide when registered for the health QR code is very, very democratic. So you can apply your true personal information or you can choose to provide a fake ID or fake number. So it is all up to you. You can choose to register or not, and you can choose to tell your true information or not. And these democratic can actually lead to very severe problems. For example, some people may simply provide their fake phone numbers to get rid of the tracking system. And in order to solve the problem, the Chinese government need to come up with some specific strategies. And the process to solve the problem can be actually considered as the process to think how to make the healthcare code work more effective in China. After some discussion, Chinese government came up with a regulation called collaborative governance. In this slide, we will see how the collaborative governance work. So the central government will first make a strongly quote unquote suggestions for everyone to use the healthcare code. However, still you have a choice to refuse to register for the code. But then when the local government receives such a strong quote unquote suggestions, they will come up with some regulation strategies. So some local government ask people to have a QR code, or some local governments strongly quote unquote suggest people to hold a health QR code, no matter they will use it or not. the local government will also make announcement about the punishment of uploading fake numbers or using fake IDs to register for the code. And after receiving the regulation policies from the local government, the institutions and the neighborhoods, such as school, bank, factory, and the theater, will come up with their own um, regulation strategies. So the regulation strategies for a school may be very different from the regulation strategies for a supermarket. And for most of the time, the institutions ask people to show their health QR code in order to enter the space. And as a result, when these regulations were finally passed down to the citizens has no choice but to register for the health QR code. So what we see in these flowchart of collaborative governance is a process of the strengthening of quote unquote suggestions to register for the health QR code. And interestingly, the citizens will actually monetizing each other to make sure that their friends or the colleagues who are working with them are actually applying the health QR code in a correct and effective way. So to sum up, the health QR code can be very special, not because it is a big data driven algorithm, but because that it is very democratic. People can choose to register or not, and people can choose to offer their true personal information or not. However, the special regulation policy conducted by the Chinese government is actually making this democratic situation into a mandatory one by strengthening the quote unquote suggestions from top to bottom, from the central government to the local government and to the institutions and finally to the citizens. We can see how the democratic algorithm turns into a mandatory one. So actually people have no way but to choose to register for the code. And I think this process is very interesting because it actually brings us four main problems to discuss. Firstly, by applying the health QR code, I think people's identity is defined by the color of the health QR code. So before we may say that people's identity is depend on their skin colors. We may have white people and we can also have yellow people. However, right now, I think there are only three different kinds of people, which are based on the color of their health QR code. For example, the people who have green color code, the people who have yellow color code, and the people who have the red color code. And the second thing I think that is interesting to be discussed is how like a person's past is not depend on what he or she experienced, but more depending on the big data he or she produced. And thirdly, I think it is very interesting to see how people's future or the things people can do in the future is depend on the algorithm of the health QR code. So basically, the health QR code depends where you can enter and what you can do by offering people with different colors. And finally, as we can see, by applying the health QR code, the smartphone become part of human's body. These four equations or these four topic has been discussed and debated for a long time. And I think in the case of health QR code, we see the positive side of the application of these four questions. But will these four equations always be on the bright side in the future? I think these are the true questions we need to think more about in the future and to discuss more about in the future research. And that is all I want to share about. Thank you.